Hi, thanks so much for joining us here today. My name is Chrissy Hand, and I'm the Chief Product and Commercial Officer for CoverMyMeds. I'm here with Ryan Merrill, who is our product leader for the Pharmacy Solutions Suite, and also with Lauren Fields, who's our Vice President for Strategy, Governance, and Operations. We are here to chat today about direct-to-patient solutions in the market. We have been hearing quite a bit more about patient direct solutions recently. Much of it is driven by some of the policy and administrative actions, but also by consumer behavior. Of course, Inflation Reduction Act contributes to this, most favored nation pricing. And also, as consumers, I think we have generally higher expectation than we ever had before about our ability to access and afford the medication that we're prescribed and to do it in a really timely manner. What would you add? What are you hearing from our customers in this space or from some of our patient research?
Yeah. It's really interesting. I think we're hearing a lot of noise right now, ton of momentum around direct to patient. And it's not just because of the policy changes that we're seeing, but it's truly because patients are demanding different things. They want ease, they want transparency, and they also want to know, hey, what are my options? How can I pay for these different meds in new ways? Because it is getting harder. And so it's great because our offering really helps bring that visibility to them and transparency in affordability and access.
Ryan, what is happening from a patient standpoint when they're choosing this channel?
Yeah, absolutely. Thanks, Chrissy. I'm really excited about CoverMyMeds Patient Direct and what we have been able to put together to help the challenges that patients and biopharma are facing today. We've heard for a long time that one of those challenges is the barriers that they encounter when they're trying to get access to the medications. We've put together a solution that is completely contained in one streamlined experience. We are able to partner with biopharma to deliver prescriptions directly to patients in their homes. We handle everything from prescription intake to medication fulfillment to delivery directly to the patient. The patient's interested in medication that is available through CoverMyMeds Patient Direct. Just go to the prescriber and ask for the prescriber to send the prescription in. And when that prescription comes in, the patient receives a text message from our pharmacy that allows them to click a link. And when they take that link, it takes them into our digital portal that allows them to review their prescription, to see the pricing, and track their prescription all the way to it as it's delivered to their front door.
And if I'm a patient, how long does this take? What should I expect?
Most of the time, once we get the prescription and they've completed the payment, we've got several pharmacies within our pharmacy network. And from the time we get that payment completed, it's generally 24 hours, maybe 48 hours, depending on the type of prescription it is. It's out the door from our pharmacy on its way to the patient. And we ship with reputable carriers in the country and gets delivered, as quick as we possibly can.
I love that, Ryan. I love the fact that you said it's digital first, right? Because as patients and consumers, we've always got our phone or iPad with us. So that's great for convenience. And the transparency that you mentioned, and then that trackability, both for price, but also for how it's getting to you.
Lauren, from a pharma perspective, what types of brands and medications do you think are the best fit for this?
Yeah, to your point earlier, lots of policy changes happening. So a lot of our manufacturers are seeing new implications to their brands regarding around MFN or IRA that's making them rethink maybe some commercial strategies and pricing. So I do think a lot of drugs that fall in those categories are a great fit, but also lifestyle drugs, many things from weight loss to hair loss, men's health. Those are actually all great fits. And oftentimes are cash pay already. It's a really great solution. And then this has it delivered straight to your house, which is great.
And do you view this as a complementary channel for pharma as they think about their market access strategy? Or do you actually think things are likely to shift from some of the traditional channels to direct patient?
For me, and my perspective is we're not here to replace the normal distribution channels, insurance, et cetera. It's going to continue and be here. This is truly complementary. And in addition to, it's helped meeting both the patients where they are, but also the market where it is.
There are lots of vendors, Ryan, who offer some of these capabilities. If you're sitting in the seat of our pharma customers, what are some of the differentiators that you think they should be looking for? And are those offered within the CoverMyMeds solution?
Yeah, that's a really good question, Chrissy. One of the things that I think is important for any biopharma to look for as they consider these types of offerings is the strength of the network.
Mhm.
Does a partner that they're considering have a pharmacy network behind them that they're able to fill those prescriptions and get them to the patients? What kind of experience do they have? What kind of capabilities are they bringing to the market with their solution? What does their patient experience look like? How easy is it? One of the things that we're focusing on with the way we've built CoverMyMeds Patient Direct is simplicity for both the patient and biopharma and the doctor. We want to make it easy for all those involved. That's one of our strengths is our pharmacy network because we have pharmacies across the country that, dispense thousands and thousands of prescriptions every day. And that is our mission, help patients get the medicines they need to live healthier lives. And that's what our staff takes joy in.
Mhm. For me, it's trust. You want a partner that you can feel good about, and we really are it. We are, backed with McKesson. We've got an amazing distribution background. Cover My Meds. Our program here. It's pharmacy led or pharmacist led, and I think that's really important. We've got clinical expertise, and we also have a nationwide network for dispensing, which I think is really great.
Ryan, you mentioned the idea of simplicity. I think the reality behind the scenes is this is a complex process from the point of intaking a prescription to it showing up on a patient's doorstep. Talk to me about how we streamline that by providing it through one service.
Yeah, absolutely. Like you said, with simplicity, that was one of the things we kept in mind as we were working to build CMM Patient Direct. Simplicity for the patient and simplicity for biopharma. So we worked to make sure that we had an all-in-one solution that provided everything that was needed. So everything from prescription intake to fulfillment to patient support was contained in one single streamlined experience. So as the patient interacts with the portal, they take fewer steps, they're given increased clarity, they see their prescription, they review the pricing, they complete checkout, and then they can track their prescription all the way to the front door.
Maybe a follow up to that. We so often hear from our customers that they want to understand the patient's journey from the beginning to the end. Is that insight that we can provide to our customers who work with us?
Yes, absolutely. That's one of the benefits of using CoverMyMeds Patient Direct is we bring biopharma right into the patient journey. We want them to have that knowledge of where patients fall off, what the problems are, so that we can be partners together in helping, patch those holes, as it were, to keep the patients continuing along and getting on therapy.
And how are we thinking about using new technology in this space? I think we all hear every day about use of AI and automation across healthcare. How should we be thinking about this for our own solution? And what would you recommend that our partners in this space are looking for as they evaluate?
Yeah, that's a great question and something that comes up all the time. You're right, Chrissy. And it's something that we are actively working on. At Cover My Meds, we believe heavily in patient-centric innovation. We want to look at opportunities for wraparound services that can help benefit our patients. And so we're always on the look for with automation and AI opportunities that can be built into our systems to help us work better, but also increase visibility to our patients and to our biopharma partners. We want our biopharma partners to be part of that patient journey, have visibility into where their patients are, into what parts of the patient journey people might be falling off,
Yeah.
so they can help try and make it better.
Maybe a final question for both of you. It sounds like this is a big emerging opportunity in the industry, really great for patients and for our pharma partners. What excites you most about the Cover My Meds Patient Direct solution? And then just overall, as you think about the patient impact?
Honestly, I have a passion for direct to patient. It's something that I'm really excited to see getting more traction. I have a belief that we're going to continue to see care go to the home. And I think this is really a great step for us. And we are able to take the technology and the expertise that we have to deliver that for our biopharma partners. And so I think we're just getting started in this space.
Yeah, I'd agree, Lauren. I'm excited, especially with Cover My Meds Patient Direct, at the flexibility and the adaptability we've built in. We know that the therapies are going to evolve and change. We know that consumers and patients, their expectations are going to shift. Well, we're ready to grow with them. Whether we're going to serve complex therapies or add additional digital capabilities to our platform, we're ready to go. Let's do it.
Well, thank you both so much for your time and for your insights, and to you for joining us to talk more about the Patient Direct model and the Cover My Meds solution.